If you can only remember one thing about Hepar Sulph, let it be its general characteristics: the extreme hypersensitivity, the chilliness, the splinter-like pain. Once you remember this, the image of Hepar Sulph will be forever embedded in your mind. Welcome to today's Materia Medica Deep Dive about Hepar Sulph. I am Dr. Reshma Nizam. So, the general characteristics are very important in Hepar Sulph, and you can correlate these general characteristics into every sphere of the remedy. First is the extreme hypersensitivity. The drug is extremely hypersensitive to pain, to touch, to cold air. The patient is chilly. It is a chilly remedy. They want to be wrapped up in warm coverings, even in a warm room. The discharges are offensive and smells like old cheese. The pains are sharp and they are splinter-like. Now a thing about craving, they have craving for sour, strong tasting substances. Now I have told you about the extreme hypersensitivity of Hepar Sulph. So they are sensitive to cold air as well. So all the complaints are worse when exposed to cold air, when there is slightest draft of cold air, when they are uncovered. Then again here the extreme hypersensitivity is seen again in the modalities. They cannot tolerate touch, worse on the slightest touch. The complaints are usually aggravated at night and the patient feels better by warmth. Now I am going to talk you through each spheres, and for that again always keep in mind the general characteristics. First is the ear. Now Hepar Sulph in ear, remember it is indicated in chronic suppurative otitis media. Here again you have to remember the pain, the discharge and the modalities. So the pain here is the sharp splinter-like pain. It is actually very severe acute pain, intolerable pain. The discharges are thick, offensive and smelling like old cheese. Modalities: aggravation, exposure to cold air, draft of cold air. The patient is made worse and they get some relief from warm room or wrapping up. You can compare the ear complaints of Hepar Sulph with Belladonna and Silicea. Now in Belladonna, there is no suppuration yet. The ears are congested. There will not be any pus, but the pain is very intolerable. Now Silicea is a step ahead of Hepar Sulph. So chronic suppurative otitis media with complication. So the complication here will be the destruction of the ossicles or the bones of the ear, and there can be severe hearing loss here. Now let's move on to the next sphere, which is the nose. So in nose, under nose in Hepar Sulph, you have both allergic rhinitis and sinusitis. So when the patient goes out into cold air, so here again the sensitivity to cold air, the patient will have sneezing, the patient will have nose block. Otherwise there will be running nose. The coryza, again here the discharge, it is thick and offensive. Allergic rhinitis, with allergic rhinitis or with acute cold, it can go into sinusitis. So in sinusitis the pain will be mostly on the right temple and root of nose. Again remember the modality of the cold air and better by warmth. Here you can compare with Merck. Merck also has sneezing and sinusitis, but Merck complaints doesn't have this sensitivity to cold air. There can be profuse perspiration at night. Next sphere in Hepar Sulph is throat. Again here throat, you have to remember tonsillitis, or there can be small pus pockets in the throat with splinter-like pain. The pain extends to ears. The hypersensitive throat, they will not tolerate any touch, they will not tolerate cold air. Now if you see the pathological progression, the first remedy for tonsillitis that can come is Belladonna. Early congestion stage, there will be no pus. Then next comes Hepar Sulph. There is pus formation, there is extreme pain with the splinter-like sensation. Next comes the Mercurius. There is the pus, offensive pus will be there, profuse salivation will be there, there is night perspiration. Later comes the Silicea. Silicea, there is peritonsillar abscess and there will be glandular involvement. So If a patient says that I feel like a fishbone in my throat, the pain extends to ears, better when I cover my throat, you can consider it Hepar Sulph. So next complaint we are going to talk about is the respiratory tract. So here respiratory tract, remember hoarseness and remember cough. Hoarseness whenever the patient is exposed to cold air. Cough becomes rattling again when after exposure to cold air. So it is usually a loose cough. Under respiratory tract also, remember the modalities: exposure to cold air, better by warmth. Exposure to cold air, slightest draft of cold air, better by warmth. Next sphere is the skin and glands of the Hepar Sulph. So abscesses of glands, Hepar Sulph is a very important remedy. In acne, in deep cracks on hands and feet, the ulcers. Now all these, in acne, abscess, ulcers, they are all sensitive to touch. If there is discharge, it is yellowish pus-like discharge with painful. It is very painful, splinter-like pain. In abscess also is painful, acne will be painful, cracks will be painful, ulcers will be painful. Ulcers are also sensitive to cold air. So that is about Hepar Sulph. Remember the keynotes: splinter-like pains, extremely sensitive to pain and cold air, wants to be wrapped up warmly, offensive yellowish pus, remedy for the suppurative stage. That's all. Please subscribe to this channel for more Materia Medica Deep Dive and mini webinars.